Satu Aisyah binti Muhammad Salihuddin. In this video, my group members and I will be presenting our group project which focus on the breast cancer dataset. I will start the video presentation with introduction. Breast cancer is a significant public health issue that affects millions of people globally, mainly women. It is a form of cancer that begins in the breast cells, most commonly in the milk ducts or lobules that make milk. Breast cancer is a complicated disease with a wide range of outcomes, and the prospect of cancer recurrence is a major concern for patients who have been previously diagnosed and treated for breast cancer and healthcare providers. The reappearance of cancer cells in the breast or adjacent tissues after time of remission is referred to as a breast cancer recurrence. Understanding the characteristic that contributes to the chains of recurrence is critical for devising suitable monitoring and treatment measures. By examining various attributes associated with breast cancer such as age, menopause status, tumor size, involvement of lymph nodes, tumor grade, breast characteristic, quadrant of the breast affected, irradiation status and class of the tumor, we can gain insight into the risk of recurrence and guide personalized care. Therefore, in this video presentation, we will explore the characteristics that play a pivotal role in breast cancer recurrence by applying the data mining techniques. Now, continue with the data description. For your information, the data for this research was collected from UCI machine learning dataset. Initially, original data consists of string value and numeric value. In order to enable the association analysis and others, we have transformed the data to nominal data type. As you can see in this slide, this is the breast cancer dataset description. We have 9 attributes which are age, menopause, tumor size, IMV nodes, node cap, deep malic, breast quad, irradiate, and the last one is class. Age is referred to the breast cancer patients in year. It determines the age when primary tumor was detected. The age have 30 to 39, 40 to 49, 60 to 69, 50 to 59, 70 to 79, and 20 to 29. Next, menopause is the period in woman's life when menstruation ceases. It also considered for status of the patient at the time of diagnosis. They have 3 status which are premenopause, Gen 40, and LT 40. For tumor size, it is referred to the patient tumor size or the size of the lump that is formed on her breast. The tumor size is measured in millimeter. They have 30 to 34, 20 to 24, 15 to 19, 0 to 4, 25 to 29, 50 to 54, 40 to 44, 35 to 39, and 45 to 49. IMV nodes is a node size in the main portion of the breast. It tells the number of axillary nodes that carry symptoms of breast cancer when the histological examination is done. They have 3 sides which are 0 to 2, 15 to 17, and 24 to 26. Moving on to the node cap attribute, it indicates whether the tumor has infiltrated the node capsule or not. Deep malic refers to the stage of breast cancer which can be categorized into stage 1, stage 2, or stage 3. Next, the attribute breast describes the location of the breast cancer occurrence, which can be either in the left or right. Breast quad divides the breast into 4 quadrants including left up, left low, right up, and right low. Irradiate or eradication refer to a treatment methods that utilize high energy X-ray to target and destroy cancer cells. Lastly, the class attribute represent the output class independent on the recurrence of symptom after treatment. It distinguishes between 2 classes, no recurrence event and recurrent events.
Okay, continue with me methodology. To obtain the data for analysis, the author began by extracting data from the UCI machine learning repository. The author made use of the data mining in this study, using a large amount of generic production data to gain knowledge of relationship and interdependence has become a research topic of particular interest. The author analyzed the breast cancer dataset using weka data mining software. The Waikato environment for knowledge analysis, that is weka, arose from a perceived need for unified workbench that will provide research with easy access to cutting-edge machine learning technique. The purpose of the preprocessor is to clean and transform the data so that it is understandable and easy to interpret. The classification is carried out by lazy group by IBK and K-star algorithm, as well as a meta group of random filter class and regressions by discretions algorithm. All these steps are used to display the analysis and visualize the result.
Hi, I am Nufazlin Hafika and I will continue the presentation with the explanation on the ranker part. Using weka, the feature selection discovers the most influential attributes using correlation attribute evaluation shown in Table 2 and Table 3 respectively. From the result, it can be summarized that the most influential attribute contributing to the recurrence of breast cancer is attribute number 6, which is Malik. This finding is not similar with research done Marisa and Yi Chao. Such method user ranker with info-gain attribute evaluation and correlation attribute evaluation have been applied to all the dataset to see if any changes in dimensions contribution to the recurrence of breast cancer. For this dataset, for info-gain, the most contributing factors will be attribute number 6, Malik, attribute number 2, menopause, and attribute number 1, age. However, for correlation evaluation, the contributing factors among the ranked attributes will be attribute number 2, menopause, attribute number 6, Malik, and attribute number 9, irradiate.
For classification algorithm, we identify 3 highest results, which is PAR, naive bias, and 1R. For your information, PAR and 1R is under rule classification group, while naive bias is under bias classification group. From the algorithm, we found that PAR algorithm achieved the highest accuracy among them, which is 82.51%, followed by naive bias 76.5% and 1R 75.96%.
Now I'm going to explain about association rules result. Using the appropriate algorithm, you want to find the association rules that have minimum support equal to 10% and minimum confidence equal to 90%. We may adjust the minimum support to 0.1 to produce a more frequent item collection. If we set minimum support 0.2 or higher, we may eliminate many attributes, but the minimum number of attributes is insufficient to make a reasonable choice. However, minimum confidence 0.9 can be set higher because this limit might provide fewer rules. Based on the result, the lowest support was 70% equal to 128 cases. The metric confidence minimum was 90% and 6 cycles. As indicated in Table 4, we identify the optimal rules. The default setting for number of best rules for appropriate algorithm is 10, and the result shows that social coherence dominated with the highest number of best rules generated, which equal to 10 rules.
As you can see in this slide, this is the decision tree based on our breast cancer dataset. Out of the 10 rules generated using a priori algorithms, 3 dimensions, which are menopause, irradiate, and age, are being selected as it is the most influential dimensions. The authors use J48 classification algorithms in order to classify and visualize the decision tree. It shows that the most contribute dimension is menopause and irradiate.
Visualizations for trend analysis. Okay. The first one, There are two types of class. The first one is no recurrence, represent the blue one, and recurrence represent the red ones. Recurrence indicates a high risk for getting breast cancer again. This dataset has 10 attributes. There are three types of menopause. Okay. As you can see, people in the pre-mono class are aged for 30-39, 40-49, and 50-59 are predominantly red. Meanwhile, the age group for 50-59 and 60-69 in G40 are predominantly red. It can be concluded that the three types of the menopause, LT40 has the best performance and pre-mono has the highest risk, shown in red. As it shows, the class of irradiations and age. Irradiate is the use of the radiations, such as X-ray and alpha particles, for medicinal or sterilization purpose, for example as in food, also known as partial or complete sterilizations by irradiations. Okay. As you can see, the age 30-39, 40-49, 50-59, and 60-69 are more likely to state yes to irradiations than no. There are none between age 20-29 and none between the age 70-79. This clarifies that people aged 20-29 and 70-79 has almost no likelihood of having recurrence of breast cancer even if they are irradiated. Menopause and class are being analysis. As you can see, a significant number of recurrence events occur in the menopause class at G40 and pre-menopause. Based on the visualizations, LT40 has no rate, indicating that these types of menopause is secure. However, the recurrence events outnumber recurrence events. This, I believe, is a good sign because patients with recurrence events are not more than patients with no recurrence events. As illustrated, a tumor size of breast cancer for menopause pre-mono with red visible at size 0.4, 15-19, 20-24, 25-29, 30-34, 35-39, and 40-44. Meanwhile, menopause for G40 become red at 20-24, 25-29, 30-34, 35-39, 40-44, 45-49, and 50-59. According to this pre-mono, women can be high risk at even size 0.4 mm, where G40 women typically begin at high risk at size 20 to 24. It demonstrates that G40 is better than pre-menopause because it can prevent cancer in its early stage.
Now let me explain about the conclusion. This experimental model is mainly focused on analyzing the prediction accuracy of the social well-being level of the students. Under the classification group, there is bias and rules. As for classification algorithm, there is naive bias, 1R, and PUT. The experimental findings demonstrated that the quality selected from the initial dataset are extremely sufficient for the unknown classes to increase their predictive accuracy. The PUT algorithm proved to be a better prediction model when compared with the other models with 82.51% accuracy on correctly classified data using the model data. This analysis will help the institution to know the breast cancer is advanced and can concentrate on factors determining objective well-being. The default option is 10 for the appropriate algorithm, and the findings indicate that the largest numbers of the best rows created, equivalent to 10, are dominated by women. The results show that the PUT algorithm outperforms the other classifiers based on accuracy and classifiers errors. Appropriate algorithm was also used to find the association rule mining among all the attributes, and the best rules were also displayed. When coupled with other data mining approaches, developing classification algorithm in this manner assists in the construction of more efficient prediction tool. The future work will focus on improving the accuracy of the algorithm. The data may extend it to collect some of the breast cancer evaluation with different classification algorithms to predict the well-being of women for the future work. The authors are also interested in working in the future to classify the diagnosis of breast cancer dataset in well-being elements. Enabling the speculative concepts and discussions continuously is vital to reduce breast cancer among women and analyzing the characteristics that will contribute to the chance of it.